Mirtazapine is a tetracyclic antidepressant used in the treatment of major depression and is used off-label as a drug for insomnia and to increase appetite. In this video, let's found. What is mirtazapine? What is mirtazapine used for? Contraindication. What are the side effects of taking mirtazapine? How does mirtazapine work? How to use mirtazapine? What is mirtazapine? Mirtazapine, sold under the brand name Remeron amongst others, is an atypical tetracyclic antidepressant, and as such is used primarily to treat depression. Its effects may take up to 4 weeks, but can also manifest as early as 1 to 2 weeks. Mirtazapine came into medical use in the United States in 1996. The patent expired in 2004, and generic versions are available. In 2020, it was the 104th most commonly prescribed medication in the United States, with more than 6 million prescriptions. What is mirtazapine used for? This drug is indicated for the treatment of major depressive disorder and its associated symptoms. Mirtazapine has been used off-label for a variety of conditions including panic disorder, generalized anxiety disorder, dysthymia, tension headaches, hot flushes, post-traumatic stress disorder, PTSD, sleep disorders, substance abuse disorders, and sexual disorders, among others. Contraindication. Hypersensitivity or allergy to mirtazapine or any component of its formulation would preclude the use of the drug. Avoid prescribing mirtazapine to any patient who is currently on MAO inhibitors. There should be a gap of at least 14 days between the discontinuation of MAO inhibitor and therapy initiation with mirtazapine. Conversely, the same amount of time, at least 14 days, should be allowed to pass after stopping mirtazapine and initiating MAO inhibitors to treat psychiatric disorders. This delay is because of the increased risk of serotonin syndrome with concurrent use of drugs. Avoid prescribing mirtazapine to any patient receiving intravenous methylene blue or linezolid because of an increased risk of serotonin syndrome. Mirtazapine can paradoxically exacerbate depression and anxiety and even cause suicidal ideation in some people. Closely monitor these patients. Side effects. Very common, greater than or equal to 10% incidence. Adverse effects include constipation, dry mouth, sleepiness, increased appetite, 17%, and weight gain, greater than 7% increase in less than 50% of children. Common, 1 to 10% incidence. Adverse effects include weakness, confusion, dizziness, fasciculations, muscle twitches, peripheral edema, swelling, usually of the lower limbs, and negative lab results like elevated transaminases, elevated serum triglycerides, and elevated total cholesterol. Those adverse effects include decreased appetite, weight loss, insomnia, nausea and vomiting, diarrhea, urinary retention, increased body temperature, excessive sweating, pupil dilation, and sexual dysfunction. Pharmacodynamic. General effects and a note on suicidality. Mirtazapine is effective in treating moderate to severe depression and treats many symptoms normally associated with this condition. These symptoms may include disturbed sleep, lack of appetite, and anhedonia, in addition to anxiety. It is important to note that suicidal ideation and behavior may emerge or increase during treatment with mirtazapine, as with any other antidepressant. This risk is especially pronounced in younger individuals. Patients, medical professionals, and families should monitor for suicidal thoughts, worsening depression, anxiety, agitation, sleep changes, irritable behavior, aggression, impulsivity, restlessness, and other unusual behavior when this drug is taken or the dose is adjusted. Do not administer mirtazapine to children. When deciding to prescribe this drug, carefully consider the increased risk of suicidal thoughts and behavior, especially in young adults. Effects on appetite and weight gain. In addition to the above effects, mirtazapine exerts stimulating effects on appetite, and has been used for increasing appetite and decreasing nausea in cancer patients. Some studies and case reports have shown that this improves eating habits and weight gain in patients suffering from anorexia nervosa when administered in conjunction with psychotherapy and/or other psychotropic drugs. Effects on sleep. The use of mirtazapine to treat disordered sleep has been leveraged from its tendency to cause somnolence, which is a frequently experienced adverse effect by patients taking this drug. Mirtazapine has been shown to exert beneficial effects on sleep latency, duration, and quality due to its sedating properties. Insomnia is a common occurrence in patients with depression, and mirtazapine has been found to be efficacious in treating this condition. Mechanism of action. The mechanism of action of mirtazapine is not fully understood but may be explained by its effects on central adrenergic and serotonergic activity. This drug exhibits a fast onset of action, a high level of response, a manageable side effect profile, and dual noradrenergic and serotonergic effects that are unique from the effects of other antidepressants. It has been shown that both noradrenergic and serotonergic activity increase following mirtazapine administration. The results of these studies demonstrate mirtazapine exerts antagonist activity at presynaptic alpha-2 adrenergic inhibitory autoreceptors and heteroreceptors in the nervous system. This is thought to lead to enhanced noradrenergic and serotonergic activity, which are known to improve the symptoms of depression and form the basis of antidepressant therapy. Mirtazapine is a strong antagonist of serotonin 5-HT2 and 5-HT3 receptors. It has not been to bind significantly to the serotonin 5-HT1A and 5-HT1B receptors, but indirectly increases 5-HT1A transmission. In addition to the above effects, mirtazapine is a peripheral alpha-1 adrenergic antagonist. This action may explain episodes of orthostatic hypotension that have been reported after mirtazapine use. Mirtazapine is a potent histamine, H1, receptor antagonist, which may contribute to its powerful sedating effects. The pain-relieving effects of mirtazapine may be explained by its effects on opioid receptors. Half-life: 20 to 40 hours. Dose: depression. Indicated for treatment of major depressive disorder. 15 mg POQHS, may increase no more frequently than Q1-2 weeks, not to exceed 45 mg QHS. Post-traumatic stress disorder, off-label. 15 mg POQHS, may increase no more frequently than Q1-2 weeks, not to exceed 60 mg QHS. Hot flashes, off-label. 7.5 to 60 mg POQ day. Insomnia, off-label. 15 to 45 mg POQHS. Safety advice. US FDA Pregnancy Category C. Animal reproduction studies have shown an adverse effect on the fetus, and there are no adequate and well-controlled studies in humans, but potential benefits may warrant use of the drug in pregnant women despite potential risks. That's all the information about mirtazapine we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.